Brian and Janelle Mornings, welcoming Dr. Mike Chen. He's with University Hospitals family physician and also former chairperson of the Northeast Ohio branch of the Cleveland Medical and Dental Association. Good morning, Dr. Chen.
Good morning, guys.
Ron and I were both looking forward to having you speak into this topic of menopause. We've been talking about it for a few days. And first, before we get started, can you give us a general idea of what menopause is?
So menopause is the season of life for women where their estrogen levels drop. So pretty much their ovaries stop producing eggs or releasing eggs. And frequently, on average, I guess the median is around 45 years old. And women generally can get a sense for this, that they're in what's called perimenopause, because their periods start coming at varying times, and they are more sporadic, or might be having some early bleeding. And a lot of times it can be associated with hot flashes. People complain about weight gain, emotional stress. Sometimes you can have vaginal dryness. It's a very challenging time period. Sorry, by the way, I'm losing my voice because I'm sick.
Dr. Chen, you need a doctor.
They're worthless. They never help me with this kind of thing. But yeah, so for many women, it can be a really, really difficult time of life. I remember my own mom going through it, and all of us were like, "Oh my goodness, when is this going to be over?"
Yeah, for real.
Because she would oftentimes, lose her temper a little bit more, or when mama's stressed, everybody's stressed. Now the flip side of that is, I don't know how empathetic I was as a teenager at that point. I was busy being selfish, thinking about myself and how her menopause was affecting me. And I think that's our sin nature doing that. I think when I encourage, and I always feel bad about talking about things like menopause, because it's like, who do I know? I'm a guy. Guys don't experience this. I'm sitting here mansplaining things. But I think for everyone else who's not going through it, to be able to acknowledge this is hard. And it's not something like, oh, it's going to be hard for a week. For some people, this goes on for years and years and years. It might have to be one of those things that you just live in the season. And you point someone to Jesus when they're flinging their blankets off in the middle of the night, or they're just having one of those days, So that's pretty difficult.
So lots to talk about here. But first, in terms of how difficult the symptoms are, is that genetic? Does that depend on how your mom and grandmother went through it?
I am no expert on this, but I suspect so. But I've seen definitely a lot of women who, like my wife, her mom had menopause when she was 38. So I suspect she's starting to head towards that direction herself. And a lot of times there's correlation between the amount of hot flashes and the timing of menopause and stuff like that. So I'm sure it's not just that, but I'm sure that's part of it.
Yeah. It seems to me like menopause is not a cut and dried event, but like a season of time. Yeah. How long does it usually stretch?
It really is dependent on the person, the situation. There are people where, they start having spotty periods, and then bam, they stop having periods, and they start having hot flashes, and 2 years later they're done, and they stop having hot flashes. And, but there's other people who, for a decade, it's a real struggle, sometimes longer. It's one of those things that's so personal, and everybody has their own story, and everybody has their own manifestation of menopause, which would part of the thing that makes it so difficult for doctors, because a lot of times we're like, well, I can't really tell you what to expect, because this may go on forever, for a long time, or it could be a mild case, and it gets better after a couple of years. So it's definitely one of those things that I think Brian has something to, people talk about, oh, well, my doctor doesn't understand, or he kind of blows this off. There's definitely times when, as a doctor, you've heard it, and there's not really a ton that we can do to make things better, and so you tend to kind of try to minimize it because you're, either A, like myself, it's not my best area, to be honest. GYN stuff is not my best area. Or B, it's like, oh, you can muscle through it. You'll be fine, because there's nothing I can necessarily offer you for it, which is not necessarily a good behavior for a doctor.
Yeah.
I would say for any women who have tried to talk to the doctor about it and are frustrated, every single doctor has their areas that they're good and bad at. And if you just get a sense that your doctor just doesn't understand or is not giving you answers that you find helpful, they're certainly going to see a GYN doctor can be very helpful. That they do this kind of stuff all the time. There's a subset of GYNs called urogynecologists who are just wonderful at dealing with any kind of urology related or menopausal type issue.
Okay.
So there's definitely help to be had, and there's definitely folks, a lot of folks who go the naturopathic over the counter approach, and there's some evidence that can be helpful. Like in particular, some people like black cohosh and soy products.
Yes.
And there does seem to be, I guess, isoflavones. They seem to have some evidence that it could be helpful. The way I look at it is it's probably not going to hurt you. So certainly if you're having a lot of hot flashes, that could be a reasonable first option. There is some question about using a lot of soy products. Is that become like biosimilar to estrogen, which can potentially increase your risk of breast cancer and heart disease? And I think that's one of those difficult things. So, hormone replacement therapy is like one of our primary ways that we treat hot flashes.
You said hormone replacement therapy?
Yeah.
Okay.
So using things like estrogen, progesterone to decrease the amount of hot flashes women have, and it is very effective. But the problem with it, and it's kind of a mixed picture, but the problem with it is overall it does slightly increase your risk of breast cancer and slightly increase your risk of stroke, heart disease, and stuff like that, which are very significant side effects. But that being said, it also decreases the risk of colon cancer, decreases the risk of fractures and stuff like that. So it's one of those things where if it was me, if I was a woman going through menopause, it would for me depend on my risk factors. If I have family history of breast cancer, if my hot flashes were just completely awful and they're something that I dealt with day in, day out. I wasn't sleeping because of it, and I was getting stressed because I was feeling uncomfortable all the time. For that kind of person, there might be a greater reason to try a short course of that hormone replacement therapy and see if it helps. That the amount of people, it's not like it's a one-to-one, like you give someone hormone replacement therapy and they get breast cancer. I think it's like you have to treat 200 some people with hormone replacement therapy in order to cause one increased risk of breast cancer. And so, I mean, if you play the odds and you're a low risk person, then it could be worth it for your kind of quality of life. But if someone has a lot of risk factors, and there's other treatments besides hormones that can be somewhat helpful.
Some of the pushback that I got from women when we were talking about this, or not pushback, but the complaints was that insurance doesn't cover these treatments well. In fact, they were like, it seems like 95% of the treatments aren't covered. What are your thoughts on that?
To be honest with you, it's not something that I have seen a lot of insurance pushback about. There's certainly the fancier ones, like the topical, like the patches and stuff like that. Those are newer medications, and so those probably would be more expensive. Things like oral estrogen, progesterone, those are older, and I think they're generic, so they're not terribly expensive. There's other like non-hormonal treatments like gabapentin, and there's some antidepressants like Effexor or venlafaxine that are also generic and cheap, so those should be covered. I would say, like, if there's ever a very expensive medication that doesn't even cover, talk to your doctor, because a lot of times there's a generic alternative that's reasonable. There's certainly benefits to the topical formulation, and I haven't touched upon, but kind of vaginal atrophy, like dryness and stuff like that.
Yeah.
A lot of those medications are newer and they are kind of expensive. But if you talk to your doctor, work with a compounding pharmacy, there's ways to get localized topical treatments for significantly less than the branded prices. So, but it is very frustrating. Especially you don't want money to be the reason why you can't feel right. You know?
Yeah. Before we wrap up, I wanted to get to the more mental health aspect of menopause, like mood swings and depression and all that. How would you get help? Because it's connected to menopause. Do you just go to your uro gynecologist and a mental health specialist? Like, how do you navigate it in the context of menopause?
So that's something that you should be able to talk to your regular, neighborhood family doctor about, because there's lots of good treatments that can help. And for my mom, I'll tell you, I'm sure she wouldn't mind me sharing this. During that time, she got started on Zoloft, which is the medicine I take for my depression. And that was an amazing gift for her, for us. And she stayed on it for a couple of years, and then when symptoms were better, and perhaps when I was a better child, her mood improved, and she stopped taking it, and she's not on it now. So those medicines are easy to write for. They're cheap and start, and they can be quite effective. I've talked about it on the show before, but if you don't want to take a prescription anxiety, depression type medicine, which you're right, it goes hand in hand. I mean, a lot of things. If you're not sleeping well, if you're not feeling good, if you're gaining weight, that can lead to things like feeling depressed or anxious. But ashwagandha is a reasonable treatment that you can buy on Amazon. Not everybody does well with it, but not everybody does well with something like Zoloft or Effexor. So I think it can be worth a trial, especially if you're not wanting to take a prescription medication. But also therapy. I don't talk enough about therapy on this program, but if it's covered by insurance and you can find a good therapist, a Christian therapist perhaps, it's a great place, because sometimes just having an empathetic ear, someone who can listen to you and understand what you're going through, that can be really, really helpful as well. I also found there's an app called I think it's Menolive. Menolive. It's a free app that you can get on Apple or Android. And it's like a menopause tracking supports and advice. So it gives encouragement towards things like exercise and drinking water. And it seems like a place where women can get non-judgmental support from other women about some of the symptoms. And it seems to have it's research-based and reasonable free app that women might consider, especially if you're talking to your husband. He's like, "Oh, it's fine. Just fight through it."
You need a support system.
Need a support, And husbands, we can do better. I think we can always do better.
And that's Menolive. It's an app that Dr. Chen recommends. Dr. Mike Chen, University Hospital family physician, thank you so much for your help in helping us kind of think through this. No
problem. And I hope I didn't offend anyone by any of my menopausal type things. I'm not expert on this. So certainly, if you feel like you're confused or question anything I'm saying, please talk to your doctor. They know you best. And hopefully people can get the help they need.
I know a lot of men are cheering for you. You just gave a gift as we encouraging us to get treatment. Thanks again, Dr. Mike Chen.
No problem, guys. You take care.